Why would the semen change with color? Why would the semen change in color? Actually, is dependent on what actually is inside the semen. So today, we're going to talk about the significance of different shades of the climax. Today, we're going to talk about different shades of ejaculations. First of all, I guess the most important thing to deal with is what exactly are the constituents of the semen that actually makes its color change. Well, first of all, the semen contains sperms and also multiple minerals that include sodium, potassiums, and also magnesiums, and all these will have a different tinge of color in the semen. In addition to that, it also contains other enzymes. There are protein-lysing enzyme, there's citric acid, and also it contains something that actually like fibrinolysin, which will break away certain type of protein. And lastly, in an abnormal cells of the semen, it may contain bacteria. On all these will contribute towards different shades of climax. If your semen is as bright red as this ang pao, then of course you get worried because you wonder whether there might be some cancers in there. In fact, there are many reasons why men might ejaculate blood as a result of the prostatic changes or prostatic inflammation. So the commonest reason why is prostatitis, which is inflammation inside the prostate. This can be related to bacteria or non-bacteria. The other reason why men might bleed into their ejaculate might be because of strenuous sexual activity or multiple short-interval masturbation. So if you're worried about how strenuous is strenuous, or whether the masturbation is too vigorous or too excessive, well, I don't really know. Different degree of strenuity might be resulting in the bursting of vessels. Well, it's strenuous enough to burst that vessel, so go easy on that sexual activities. Of course, there are other reasons why people ejaculate blood, and this blood can come in different shades. In the early stages, might be bright red, followed by orange in color, followed by multiple brownish color, or sometimes might even black in color. Of course, cancer is always at the back of our minds. If you're someone at risk of cancer, or you're somebody who worry about cancer, why don't you see a doctor and get your PSA, prostate-specific antigen, checked out? If you're jaundice, your bilirubin actually get trapped into your semen and produce yellow ejaculation. If you're dehydrated and also your urine get mixed with your semen, it also can have a tinge of yellow. And if you've got sexually transmitted infection, and that might change the texture from yellow to actually green in color, then you're in trouble. You really need to get that urinary tract infection sorted out. Lastly, certain medication. For example, medication that contains sulfur or medication that contains different minerals might change the color of it to make it slightly yellow in color. Of course, different shades of color has different meanings, and different texture also have different meanings. So whether it's more jelly or more liquidy, what does it mean? In fact, there are some studies to show that more liquidy semen may be related with infertility. So if you're having trouble conceiving, perhaps have that semen analysis looked at. If the semen is very thick in texture, sometimes many days of non-ejaculation might contribute towards that. Alcohol will affect the texture and also the color of your semen. So if you want your semen to normalize, go easy on that alcohol, even though it's Chinese New Year. Next week, we're going to talk about something else which might be never ending for somebody. What happens if you find it difficult to get ejaculation? If you're interested to find out, or your partner needs some help, then you know what to do. Carry on putting Dr. G on the spot.